I am just coming back from a hospital after discharging a 27-year-old lady. It's an unfortunate story. She's better now. So this lady has been having joint pains for the last 4 years or so. So initially when she had this, she went to a local hospital where the practitioner identified that she had some form of an inflammatory arthritis and had given her low dose steroids and had asked her to come back with some investigations. This lady did not do that. Instead, what she did is she has been taking 10 milligram of prednisone for the last 4 years. And now, just because she felt that she was getting breathless, she came to us. When we examined her, her BP was 204 by 140. The normal BP should be around 120 by 80. So she had almost double the normal blood pressure. Immediately I knew that this is probably a case of lupus, that was not diagnosed, not treated, and now must have involved her kidneys. We got her kidney function tests and found that her creatinine was beginning to elevate. Her creatinine was high, suggesting that her kidney was slowly failing. So we had to immediately admit her, give her high dose steroids, control her BP aggressively, do a kidney biopsy, do all the tests, and then today somehow we could bring her BP under control, bring her disease under control, and discharge her on medication with clear instructions stating that please come back in 15 days. This unfortunately is a common story that prevails in most part of our country. Young women, they are actually weighed down by the burden of taking care of the family, weighed down by the burden of taking care of their children, their husband, their in-laws, their parents, because everything is on the lady's shoulder. They just ignore their symptoms and go on with their life till a point when it does not become actually controllable. I am talking about lupus, my friends. Lupus, the name itself originates from Greek. The Greek word lupus means wolf. Why was it named so? It was named sometime in the 13th century. A physician saw these pretty women having facial rash or skin rash as if some wolf had bitten them. So this is how the term lupus came into being. But here, though it says that wolf bites them and there is a lot of skin rash, but in our case, this wolf was hiding in a sheep's skin. It only came as joint pains. She did not have any skin rash. She did not have any other features that could tell the doctor early on. So let us understand what this lupus is. Lupus is also known as systemic lupus erythematosus. Yeah? Systemic means it is not only the skin condition, it is everywhere in the body. Lupus means lupus, wolf that has bitten off your skin. Erythematosus means lot of redness, also means lot of inflammation. Inflammation in the skin, inflammation in the joint, inflammation in the kidneys. Especially in India, we have seen that more than 60% of the women who have lupus or SLE or systemic lupus erythematosus have kidney disease also. So for this they'll need a biopsy and then lot of treatment changes. So with this picture, what does this lupus have? What are the symptoms this lupus can have? Some of the symptoms that lupus can have is joint pain, as we already saw in our patient. This joint pain will be severe sometimes it will be mild, it will be fluctuating in nature. But one thing is for sure, that it will limit somebody's day-to-day activity. Second would be there's a lot of hair fall. Nobody understands why this is happening, but there's a lot of hair fall. Third would be a facial rash. A facial rash that gets bad when you are exposed to sunlight, also known as photosensitive rash. And this facial rash will occupy the face in such a way as if, there is a butterfly shaped tattoo on the face. It's also called as a butterfly rash. Such a beautiful name, such a beautiful insect, but such a deadly disease. These patients can also have kidney disease. So kidney disease can manifest in different ways. They can have increase in blood pressure, which could have been detected by a physician. These patients can have frothy urine. That is, when they go to the toilet to pass urine, they find that their urine is becoming very frothy. This is because there is protein leakage in the kidney. Or they can start passing urine multiple times in the night. Before they wouldn't do that. Or they can have swelling of the face, swelling of the legs, which are all signs of a kidney inflammation in lupus. But most of the times none of this is seen, because the doctor will be proactively testing for kidney disease and will be identifying the condition even before these things occur. Then it can involve the blood cells. Patient can have anemia, patient can have low platelet count, patient can have fever, patient can have repeated mouth ulcers. So skin, blood, kidney, joint, you name it, all the organs can be involved. I have missed out the brain, but brain can also be involved. Young patients having seizures, not knowing what the cause is. Young patient having psychotic breakdowns all of a sudden, not knowing what the cause is. Young patients having cognitive impairment, forgetfulness. They are not able to perform their professional work properly. And most importantly, chronic tiredness, long-standing tiredness and fatigue. This is another key symptom of lupus. Then the question is, who gets lupus, right? Which is the age group that this deadly disease really affects? If you see who gets lupus, so the lupus is heavily biased towards women. So we say that for every 8 women, maybe 2 men will get this condition. So it is a female predominant condition, mostly because it is autoimmune disease, and most of the autoimmune diseases, as we know, are more seen in women. Besides that, the age group, if you see, children can have lupus, called juvenile lupus. Very young children, 1 or 2 year olds also can have lupus. This is because of a genetic defect, which is monogenic lupus. But the usual time when lupus comes, or the usual age group in which lupus is seen, is between 20 and 40 years. So this is a very fertile, productive age. These patients will be getting married, planning family, already having children. So this is the age when lupus hits maximum. Even elderly people can get lupus. It is called elderly onset lupus. But the majority of them who suffer from lupus, if you see in India, are between the age groups of 20 and 40. So then, doctor, is there anything that we should be careful of when we, to get diagnosis of lupus early? Definitely. If, like in our case, there is a arthritis that is seen in very young people, less than 40-year-old having arthritis, then lupus should be kept in mind, even though the rheumatoid factor and other things are positive. Second, if you see, if somebody has told you that your blood counts are always low, maybe anemia or maybe platelets are always low, or even the white blood cells are always low, even then we should start thinking of lupus. Next, if a young person has got repeated fever and there is no cause that is being identified for it, even then we should think of lupus. And finally, if you have skin rashes, skin problems, or if you have excessive hair fall along with any of the other symptoms that I already mentioned, then definitely we have to start thinking of lupus and you have to see a rheumatologist.